There are symptoms that you should really not ignore in your feet. Don't ignore them, because there's a lot of systemic things that can be going on that you first see in your feet before you actually have any symptoms. People come in for a problem, we do a physical exam, they come in for normal things like heel pain, bunion pain, and things like that, traumatic events. But then during physical exam, we can actually see other things. More specifically, nail changes. There are striations, lines, discolorations, the contour of the nails, the things of that nature that can actually tell us a glimpse into what could be going on health-wise. Have somebody look at it. Obviously, if it's normal, you have lost nothing. But if it is not normal, if it's abnormal and you ignore it, it can come back to bite you later. So we really want people to kind of be proactive and look at these little signs and symptoms that most often we ignore. Lots of people see us when they have ingrown problems. Eventually, it can get infected. The infection can actually get deeper into the bone, which is really not that deep under the nail plate. And many times, a simple procedure that can be done within 10-15 minutes in the office and fully resolved ends up being a patient in the hospital on intravenous antibiotics, and eventually even sometimes, unfortunately, can become amputations. Intermittent claudication in majority of the cases to most of us just means pain in the feet or the legs, but in reality, if you actually look deeper, it can be an underlying vascular problem. If you get up to go get the newspaper or get the mail or walk at the mall for a certain distance, but it's always the same exact distance, that you develop pain and you actually have to sit to regain composure because the pain was there, and now the pain is resolved in your legs and your feet. This is vascular problems that could be going on. This needs to be addressed. That's something that needs to be done. People often complain of having cold feet. This can certainly be an alarming factor for patients to realize that there is definitely something wrong when you have cold feet in summertime when it's scorching hot. Depending on the nature of the problem that is causing the cold feet, certainly other options are available. There are injections available that we actually do perform that causes dilation or opening up the blood vessels, which can help that. There are laser treatments that we do, which typically are safe for patients that cannot tolerate the injections. There are many times that we actually encounter the pain in the ball of the feet. If it feels like you are actually walking on marbles, and no amount of cushioning is enough and you have pain, that needs to be addressed. That is a simple evaluation that can actually tell you if you're suffering from the atrophy or loss of fat pad in the bottom of your feet. It can actually cause a lot of pressure and eventually result in ulcerations. A simple procedure that we've actually developed is replenish the padding in the bottom of the feet. It requires simple injections that actually helps replenish some of that and helps this process to reduce not only their pain, but also replenish the fat pad. As a physician, what I want you to know is do not ignore your feet. Do not ignore your legs. Do not ignore your symptoms. A simple evaluation can actually help you in the long run.